Good morning and welcome to the Chamber's Pulse on Policy series. I'm Dana Harris, Vice President of State and Federal Advocacy at the Austin Chamber of Commerce. We know this is a difficult and uncertain time for all of us. The Chamber is trying to do what we can to provide information and resources to our member businesses. Today, Congressman McCaul will be walking us through what small businesses need to know about the $2 trillion emergency spending bill, the Coronavirus Aid, Relief, and Economic Security CARES Act. This webinar is part of the Chamber's Pulse on Policy series, and we'd like to thank this year's sponsors, AT&T and Amazon. If you have a question, please use the Q&A button on your screen. We will do our best to get to as many questions as possible. At this time, it is my pleasure to introduce Congressman Michael McCaul. Congressman, throughout your career, you have been a steady leader through times of crisis. And certainly Texas has had its fair share. But perhaps never before have we experienced something so disruptive, concerning, and unprecedented. We are grateful you have always had your finger on the pulse of Central Texas employers and businesses and supported policies that promote economic growth and help us create more quality jobs for hardworking Texans. Thank you for carving time out of your day to speak with the Central Texas business community. With that, I'll turn things over to you.
No, thank you, Dana. I want to thank you and the Austin Chamber for hosting this webinar. And I want to thank everybody on the call for joining us here today. Look, this virus is not something we asked for or were expecting, but it's a fight that we now have. And I fully expect us to win in this fight. There are over 700,000 cases reported globally now and 33,000 deaths in the United States. Over 150,000 cases are now reported. We have 2,500 cases in Texas and 34 deaths, including the first one in Austin just last Friday. We've heard a lot about social distancing, and I want to echo what Mayor Adler and Dr. Escott said on Friday about Austin. Austin has achieved a 50% reduction in interactions through social distancing. However, we do need a 90% reduction. Because of protective measures, we need to continue to take the flatten the curve method and prevent further spread of this disease. Many businesses went dormant or closed and had to furlough or fire their workers. We had 3.3 million unemployment claims last week, demonstrating that fact. Last night, the president announced an additional 30 days of social distancing. Congress recognizes this is painful and stressful on businesses. So on Friday, I was proud to get on a plane, fly back up with protective gear and vote on a $2.2 trillion coronavirus economic support package. We passed this bill to help businesses such as yourself weather this public health emergency. And I'd say that a big part of this bill was really focused on small business and the American workers. So let me walk through the ways this helps business and their employees, and then we'll open it up for questions. And I'm going to focus on the business aspects of the bill. We can talk a lot about the latest antivirals and vaccines, but for now, I think we're focused on this bill and how we are helping small business. We do provide a $350 billion package in forgivable small business loans to help keep people on the payroll and stay liquid while they are closed. It is also important to note that this includes self-employed and others who would not qualify before. For those who do not qualify for small business loans, there is a 50% tax credit for employers who pay wages. For businesses of all sizes, this bill delays payment on your 2020 payroll taxes until 2021 and 2022, freeing up cash flow. In addition, we allow businesses to carry back losses from 2018, 2019, and 2020 to the previous 5 years, which will allow business access to immediate tax refunds. And finally, for those businesses who still cannot make payroll, their workers have assistance. Our pandemic unemployment assistance provides $600 more in unemployment to the existing unemployment insurance per week from April to July. This is on top of those Americans eligible to receive the $1,200 direct deposit. That would be $2,400 per couple and $500 per child. I believe that in order to cure our economy, we must cure this disease and flatten the curve by social distancing. That is our best way to get out of this right now. In the meantime, this bill is much needed, gives much needed help in short term in order for business to prosper in the long term. And I realize there will be questions about the implementation of these measures, as well as questions about certain industries that did or did not make it into this package. But as we continue through this process, please feel free to reach out to me and my staff, and we'll be glad to help you with any federal agency or take into consider any policy proposals you may have. We actually learned quite a bit being back in our districts, talking to the people back home. Before I take questions, I know many of you have technical questions about implementation of these provisions, and while we may not be able to get too much in the weeds here, please stay in touch with my office as these new programs get started. And furthermore, later this week, I will be hosting a telephone town hall live with the SBA's Houston Regional Administrator that you will all be able to be invited to participate on. So finally, we will provide fact and question documents to help answer any questions we do not get to following this call. And with that, Dana, I yield back to you to answer any questions.
Thank you so much, Congressman. Our first question comes from Noel Stout with Stout and Associates. Where should we go when we need help in filling out the forms? When will a checklist of needed documents be available to support loan request?
It's a great question. We wanted to make this as easy as possible. So instead of having to go to the SBA, which can get very bureaucratic, we facilitated this process where you could just contact your bank. So you can contact your bank that you do business with, and they will be best to help you walk through this process. They're being educated right now on the process. So these loans that are being given out will have the full backing of the federal government and guarantee of the federal government, including forgiveness provisions of these loans. I think the basic idea here is to keep businesses afloat, keep people on the payroll through these loans that many of which will be forgiven as a business loss. In addition, again, I'm going to have this telephone town hall with the Houston SBA Regional Administrator this week, and I know that they're planning on coming out with guidance documents. And I'm sure on that call, which I think will be Thursday night, they'll be able to provide you more information. Thank you for that call, Noel.
When do you expect the Paycheck Protection Program loans to be up and running, Congressman?
We think the time frame I've been given was around, it'll take about 2 weeks to process. Okay. So I was told from the date the bill was signed, it'll take anywhere from 2 to 3. We're hoping that 2 weeks we'll have direct deposits of these checks. And for those that we can't have direct deposit, they will literally get a check through the mail.
Thank you. The next question comes from Linda Carter with Life's Next Step. I have heard one version of the relief that had been knocked around to include employers not paying payroll taxes. Is this part of the CARE Act?
Yeah, that's correct. If you do not receive a payroll protection plan loan, then you can defer payroll tax payments for the next 6 months and then pay them back in 2 years. Again, this is another, you can qualify under the loan program. If not, you can defer your payroll tax payments for the next 6 months and pay them back in 2 years. This is to keep as much cash flow and liquidity into the market, into small businesses. And I get that question a lot. So thank you, Linda, for that question.
The next question comes from Ryan Runkle with Hope C. Runkle. Why are the Section 7A loans limited to 8 weeks of payroll if it looks like this may go longer than 2 months?
Well, that's a great question, Ryan. This was the 8 weeks we think this is going to be the hardest time frame. It's going to get worse before it gets better. We have not peaked with the virus. We've looked at where Italy went and China. We're actually probably 6 weeks behind in terms of when the United States started to get impacted by this virus. And so 8 weeks was sort of a guideline given to us by NIH and others as the length of duration when we think we're going to get hit the hardest. I know the president and all of us want to get the country back and running by June 1st, but I also understand that's aspirational. And I think if this doesn't clear up in 8 weeks, then I fully expect that Congress will convene to take further action. In fact, there are already discussions being had right now about an additional bill that we may be voting on in the next week or so. But that's just an aspirational goal of 8 weeks. And if necessary, I know that Section 7A loans will be extended beyond that period of time if necessary. So thanks for that question, Brian. Appreciate it.
The next question comes from Mary Scott Neighbors with Strategic Partnerships. Is it possible that the company applying for the loan and relying on forgiveness of the loan at the end of the year be responsible for the entire amount of the loan if anything changes with the government program?
Well, it's not possible absent an act of Congress to change that. So if you apply for the loan relying on forgiveness of the loan, that is the law, and it would have to take an act of Congress to change that law. I think that it's very highly unlikely that will change. And as for myself, I would say that I would not support, nor would my colleagues in my judgment support changing the rules in such a way that would hurt small businesses. So I think you're relying on that forgiveness, the forgiveness provisions of the loan program will very much stay the law. I don't see any chance of that changing. And so really another great question, Mary. I appreciate that question.
Thank you. The next question comes from Deepak Suthar, owner at OsteoStrong. If you have already applied for the emergency disaster loan and let's say that gets approved, can you refinance a portion of that into the Payment Protection Program for relief?
Another great question. My understanding is that while you cannot, double dip on the loans for the same purpose, that you would be able to refinance that loan for the Payment Protection Program. So even if you have an emergency disaster loan or you applied for that, you could still refinance that loan under the Payment Protection Program and have all the benefits of the bill we just passed just the other day. So thank you, Deepak. That's a really good question as well.
Our next question comes from Scott Cronk, owner at TYLAS International. If you have an employee contractor earning $110,000 annually, is his or her full salary excluded from the Paycheck Protection Program, or just the $10,000 over the $100,000 limit in the bill?
Yeah, and so this is all targeted towards small business, small businesses and with employees earning under 100,000 and under. So under the bill text specifically, anyone making over 100,000 is excluded from the program. However, having said that, I believe the SBA will likely issue guidance clarifying this, because this is a question that comes up quite a bit, and I think it is creating some confusion. I would invite you to get on my live telephone town hall this Thursday night. I think we'll probably do about 7 p.m. Austin time with the regional small business administrator. And he'll be able to answer, a lot of these questions on, guidance and clarification that's coming down after we passed, this bill. Also, my website is McCaul.house.gov, so MCCAUL.house.gov for guidance on both on this issue, but also on the health issues, which I know Look, this nation, the world, we haven't seen a global pandemic like this really since the 1918 Spanish flu. And in that time frame, 500 million people came down with the Spanish flu. It was a global pandemic of epic proportions. And that's probably the closest thing within recent times that we've seen anything like this. I know it's a time of high anxiety, and it's created a lot of health concerns along with economic concerns as well. I do think with the antivirals that are coming out and the new vaccine that's being tested, specifically the antivirals coming out, that we're going to start seeing some stuff in the next few weeks that I think will have, hopefully, as we test them in humans right now, some hope moving forward, so that we'll have some assurances there's a treatment out there that could prevent illness and death. And then as we move into the summer, most scientists agree that this virus does not like the heat, and that we'll see things on the decline, as we're seeing with other nations as well. We will get through this, but we're in that critical time frame right now, and we're going to be in the critical time frame again, I'd say, for at least the next 6, even possibly 8 weeks. So with that, Dana, I'll yield back to you if there are any more questions that anybody has.
How do you view China's role in this virus through your role as Foreign Affairs Ranking Member?
Thank you. I've been, investigating this. Look, we're trying to save people's lives right now, and that's where our focus is. But to ensure that this never happens again, it's important for me. I chaired Homeland Security for 3 terms in Congress, and we term limit now. I'm the top Republican on Foreign Affairs Committee, and China, in my judgment, went through a period. This really came out in China like late November, early December, and we saw a systematic, I think, process where they tried to cover it up. And this is the Chinese Communist Party, not the Chinese people. The people are the victims, and they detained 8 of the doctors who were sounding the alarm that, hey, we have a new virus and it's life-threatening, it's different. It all comes out of what they call these wildlife wet markets, where they have these sort of exotic, poached, endangered species that they are kind of viewed to be a delicacy in Asia. And unfortunately, this is what brought SARS to the world. And they shut the markets down, and they opened them up, and then it brought the avian flu to the world, and they shut them down, and then they opened them up again. The WHO, in my judgment, didn't help a whole lot when they echoed the Chinese Communist Party's rhetoric that this was not human-to-human transmission, when in fact it was. And we had 5 million people attend a festival in Wuhan in mid-January, where 5 million people traveled to Wuhan and then left, traveling both domestically and internationally. And that's when we got our first case in the United States, was in January, after the 5 million departed Wuhan to spread throughout the world. This could have been stopped. I think it could have been contained, but it wasn't. And it will be one of the lessons learned that we will have to deal with to ensure that this never happens again. And we know where it comes from. We know how to stop it. We just don't have the treatment or vaccine right now. And that's, what's heartbreaking to me is that it could have been prevented. And to see people trapped in their homes and, with the social distancing, seeing people, trying to get food and just the panic and anxiety out there is really really hard emotionally, I think, for a lot of people to deal with. And it's taken its toll on everybody, including members of Congress too. And so I feel for everyone on the call, and we are doing everything humanly possible, not only to get to the bottom of what happened, but moving forward, what can we do to stop the spread of this virus, to treat it most efficiently, and to get the vaccine out there and then to provide the economic assistance that we desperately need to make sure that we can get through this and keep the businesses afloat and people on the payroll as we get through the next, 6 to 8 weeks. We went into this with a relatively, I would say, very strong economy, one of the lowest unemployment rates ever, and markets doing very well. I can only imagine how worse it would have been had we not had that strong of an economy moving into it. But we will get through this together. We're all Americans working together, and we will remember 2020 as a very historic and very tough year for the world. And thank you for that question, Dana.
Thank you. What CARES relief is available to companies that only use independent contractors, not employees? And how about the independent contractors themselves?
Yeah, I get that question a lot. What about sole proprietors? What about independent contractors? They're all covered. So Congress expanded unemployment to include those who are not covered previously, like contractors and what they call the gig economy employees, and that'd be people like Uber drivers. I get the question a lot about 50 employees or less. Would they qualify? And the answer is yes. So we had a very expanded definition of unemployment to include as broad of a universe of people that we could, in this legislation. So I guess the answer to that question is yes, and it's a good one because a lot of people, they may be sole proprietors or they may be an independent contractor. They may not have a whole lot of employees, but they just want to know, are they covered by this? And the answer is yes.
Thank you. If a business has less than 50 employees and are exempt, can we still take part of this act?
Yeah, the simple answer is yes, and that was taken into account when the bill was drafted. The thing I like about this bill as well is it wasn't done, in a matter of hours and thrown on the floor at 1 o'clock in the morning. It was actually done after a lot of discussion, both sides of the aisle and with the administration, to try to get the best ideas out there. I don't think this is the last bill you're going to see. And I always want to reach out to my business community. For any of you out there who have any ideas, as you look at this bill that's very focused on small business, if there's something missing or something you think needs to be in a future bill, this is where a lot of these great ideas came from, was members going home to their districts and listening to, the people we represent and the businesses and small businesses that we represent, to try to really get the best ideas about how can we keep this economy afloat? How can we keep people on the payroll as they telecommute? Now, most people are telecommuting. I had a really good conversation with Mayor Adler in his office, trying to push people towards that route. But how can we keep small businesses alive so that when we do come out into the recovery phase, into the phase that I think will happen in the next 6 to 8 weeks, that they will be as whole as possible. And when the rebound occurs, that the businesses will still be in place. The worst thing that could happen would be for small business to collapse, for people to be off payroll, and then we have to start all over again. And that's the worst case scenario. That's what this bill is designed to prevent, is to maintain small businesses, to keep them as whole as possible, and keep the people on the payroll as we get through this really hard time, tough time. So thank you, Dana.
Thank you. This question is from Elizabeth Christian. She sits on our board. Our banker is eager to help, but worries that the money will be drawn down very quickly. Will Congress consider adding more if the funds get used up?
Yeah, and the mechanism is through the small business SBA through loan guarantees. I mean, all these loans will be backed up with the full faith and credit of the United States government. So we want to keep that cash flow out there. That's the cash flow and liquidity of small businesses is essential to keeping our economy afloat while we get through the hard time, the 6 to 8 weeks. After which, I'm hopeful that we're going to have a strong rebound. I think there's a lot of demand pent up out there that will be unleashed coming out of this hard time that we have. And so, yeah, that's I think that's $350 billion that we appropriated. By the way, historically, this is the largest appropriation ever done by Congress in the history of this country, and it's designed to help the small business.
Thank you. What are your views on the various treatments out there, and what more should be done to get approval?
That's an excellent question. I try to, we are really on the cusp of some really exciting things. I think what we realize, look, CDC is great, but we gotta harness the innovation and ingenuity of the private sector. And when we started to do that, there have been a lot of companies that have been working on the family of coronavirus. Now that goes back to SARS, MERS, Ebola. Ebola is a good example where there's a company called Gilead that started to work on an Ebola treatment. And what they found, when I got briefed by the vice president and the task force, what they found was that this antiviral that they had already manufactured works in the laboratory, worked very effectively against the coronavirus. So that treatment is now being used on 1,000 patients in China as I speak. We're supposed to get a report in Congress first week of April on the efficacy of that program to determine how we can, if it is effective, first, how can we mass produce this antiviral? This would be like, what Tamiflu is to flu. People are obviously, the panic here is that people don't know if they're going to live or die. If we come out with an antiviral treatment like this one, I think will really calm the fears of the American people and the world that, my God, there is a treatment that actually can work. And so far, and I've got a call with this company later this afternoon, it looks relatively positive, and so then it's going to be, how can we unleash the private sector to mass produce this antiviral so we can get it to first the high risk population, that would be elderly and chronic lung disease patients, but then really anybody that ends up in the ICU or the hospital would have access to this. This hopefully will be a life-saving treatment. There's also a antibody serum. They take this from survivors. Now we have quite a few in the United States where they literally take antibodies from the survivor and turn it into a plasma serum. This is right now being used as a prophylactic for first responders and healthcare providers. What we saw in Italy, a complete disaster, because the healthcare providers themselves came down with the coronavirus, and the entire country and the infrastructure collapsed. So we don't want to see that happen in this country. That's why the PPEs we talk a lot about. I was able to get many of those for Texas, but also NYPD called, and they have a crisis up there. But this antibody serum, it's an old, true, tried and true way of doing things, and it works. And so at the same time we're looking at this antiviral, we're also doing these antibody serums. We're processing that as I speak. We also have, we were able to determine the DNA sequencing on this in a relatively short period of time. It was 4 days. To put that in context, with HIV, it took about 4 years to get the DNA sequencing. And why is that so important? Because if you get the DNA sequencing, then you can start the road towards a vaccine. And that's what we've done. So we actually have a clinical trial experimental vaccine that's being tested on humans in Washington State right now for safety. The problem with vaccines, though, it's going to take probably a year before we can prescribe that to, millions of people. So those therapies are out there. And I think the one that's been talked about the most when you watch television and others, this anti-malarial pill that's been out on the market for a long time. That used with azithromycin, which is an antibiotic. So the anti-malarial is sort of antiviral, and the Z-Pak would be the antibiotic for bacteria. The FDA is now testing this combination of drugs in New York as I speak, to determine the efficacy of that combination. And so I think those are several things out there that they're really very much on the horizon. And I've been pushing hard to get the stuff both tested on humans, but also start the process right now, even before we get the studies in, to get the facilities up and running for mass manufacturing, mass production of these treatments, so that people will have some, calmness. And I understand the anxiety and the panic. And the last thing, Dana, I want to mention is the test that we've had is a fairly intrusive test that swabs through the nasal, very deep into the nasal passages, not the most pleasant experience. And it takes, usually 3 to sometimes 5 days to get the result. Now we have the FDA just approved a test that we're pushing out as far and wide as we possibly can. It's a swab that's very unintrusive and can give us a test result within 5 minutes. So this is something that we're trying to get out. I know the FDA is approved, and we're trying to get out, for compassionate use right now, but we're going to mass produce this test as well to get it out. And my vision for all this is that you're not going to, sure, a doctor will have to say you have the symptoms for the test, but my hope is you just go to the CVS, Walgreens, just like you would to get a vaccination for the flu or get tested. You could do the same thing and make it very easy for people to go to their local drugstore and get tested. That's where we want to be. We're not quite there yet, but I do think it's a matter of weeks, not months, before we'll be there. So thank you for that, Dana. That's tried to kind of give a summary of where we are on the health standpoint, because I know a lot of people are very concerned out there.
Yes, they are. We have a lot of questions about nonprofits. What can they expect out of this bill?
Yeah, so that's a great question too. We had a lot of questions about nonprofits, and then churches as well, and 501c3s, and the short answer is they are included in this package that we just passed. 501c3s are eligible for SBA, under this SBA assistance program, both the loans and the tax provisions. I believe nonprofits, particularly right now, when you look at them, are really critical in our response efforts. I went down to Meals on Wheels in Austin to see what they were doing, and to get meals to the most vulnerable in our society, or the elderly and people that can't get out and get food on their own. To make sure that nonprofits like that, Mobile Loaves and Fishes, Meals on Wheels, all these great nonprofits out there, they are really truly the first responders right now, saving lives, and we want to make very sure that they were included in this small business package, and they are, and that's that came from from the ground up. I mean, that was not something that was necessarily at the higher levels of leadership, but so many members came back talking about this issue that got ultimately put in the bill. And that's a good example where your voice counts, and would really like to hear from, I know there are about 500 people, small business owners and employers on this call that We'd love to get your ideas moving forward. It does make a difference to hear from you. And I do think there's going to be another bill coming to the floor, in the near future. So, I'd advise you to contact my office. And again, my website again is mccall.house.gov.
Thank you, Congressman. One question, as you know, Austin has had one of the big topics here has been the homeless problem downtown and across the city. Is there any assistance grants in the bill for the homeless?
Yeah, thanks for bringing that up. I knowing the situation in Austin, and I actually, when I was downtown the other day, you see joggers and then you see a lot of homeless people down on the street, and they're getting more desperate, and with that, it gets more dangerous, I think. I made a request from Speaker Pelosi and Leader Mitch McConnell while this bill is being prepared to include assistance for homeless grants to help with the treatment and housing and shelter and feeding of the homeless. We were able to get $4 billion put in that package to help treat the homeless. It's a big issue in Austin, probably one of the biggest cities with this issue. I mean, San Francisco has a really bad issue with the homeless, but I think Austin, as everybody knows that lives there, it's a huge issue that we have to deal with in a responsible way. And I'm glad that the Speaker, that Pelosi and Leader McConnell granted my request through this $4 billion homeless grant program.
Thank you. The next question comes from Fred Heldenfels, who is the chair of our Federal Advocacy Committee at the Chamber. Is Congress able to act on requiring local and state governments to use the Department of Homeland Security guidelines, CISA guidelines, on essential business and infrastructure in order to avoid the confusion created by the inconsistent language and definition of municipal orders?
I think my short answer is no. They would not. But Fred, let me dig into that to get you a more specific answer, and I'll get back to you. But I don't think. Those are just guidelines. It's not like law. So a guideline's a recommendation, so to speak. It's not a mandate in law. So guidelines and recommendations are good. You always want to try to follow those, like the CDC guidelines on 10 or less people. But it's not, it's a guideline and recommendation. Doesn't have the force and effect of law. So unless the mayor, acted on that, it's still just a recommendation, and it's not a mandatory provision. So does that make sense?
I think so. Okay. Are 501c6 organizations included in the economic recovery package?
I don't believe they are. That's what we're looking at. At least in the last package, they are not included. That's something that I think is being looked at in terms of the next bill that could be coming to the floor. And any input, I don't know where the question came from, but certainly that the individual who had the question, you want to contact my office, about that. That's something we can address moving forward. But as I understand in this, the phases that we had, the first phase was $8 billion. It's hard for me to rattle off these numbers sometimes because it's just, would be unfathomable, just months ago. But $8 billion was in the first package, which I fully supported to provide these tests to all Americans free of charge. We also had a lot of investment in these antiviral treatments and vaccines in that first phase. The second phase had the test for all Americans. The first one was primarily for the research development, treatments, and vaccines. Second one was the tests for all Americans free of charge. Paid sick leave provisions were in there, unemployment insurance, and a few other issues. And then the last bill, as you know, had primarily small business relief was the biggest part. We also had $150 billion for hospitals, because we need to keep our hospitals open and afloat. And if our hospitals, if that infrastructure falls down, we'll go the route of Italy. And we've learned a lot from watching what happened in Italy. So we have to back up our hospitals so they can stay afloat, open. The personal protective equipment's been a big issue to try to get all that out. And so that was a big part of this last phase as well. And then, the distressed industries, that being the airlines and hospitality industry. There may be people on this call who maybe work for one of the airlines or work in the hospitality industry. All these restaurants being closed or just having to-go orders is taking a huge hit on our local economy. Just, closing South by Southwest and in Austin to the closing of the Houston rodeo in Houston had a major impact on the economy. I talked to Dr. Escott in Austin. We had conversations about that, and I think in hindsight, as painful as that decision was, I think it was the right decision, because it would have brought in a lot of outsiders into Austin that would have made things a lot worse. Now that's the third phase. We will have a phase 4, I think, and so that's where I think this question would be very relevant to bring up as we move into a possible phase 4 bill.
Thank you. So our last question, kind of a twofer. Will there be a step-by-step flow sheet or diagram that can help guide small businesses in finding and applying for resources? And what can they expect to see on your website regarding resources? I know that there's a SBA step-by-step coming, I do believe, and other resources available.
Yeah, and that's very much needed right now. The SBA is actually coming out with that. They're working on that right now. We should see it hopefully certainly day or hour in the future. I will immediately put it up on my website, which is mccall.house.gov. They're also, SBA is coming out with a fact and question sheet. But this flow chart will also be coming out. And I would encourage everybody in this call to participate in the Thursday night telephone town hall, where I'll have the SBA administrator on the phone talking about these very issues. And I'm hopeful by that point in time that flow chart will be out. And I think the fact and question will probably be out in the next 24 hours, if not today. So, and as soon as I get that day, and I'll send it, everything we get, they can go to my website. I've got a resource page, and I will certainly send that to the Austin Chamber as well as soon as I get it.
Great, thank you so much. And Congressman, thank you so much for joining us today and taking so many of these questions. We had over 565 people on the line at one time. So I know this was a very timely call for us, and we appreciate your time.
Thank you, Dana. Thank the Austin Chamber. And I know this is a really hard, one of the tough times we've seen, certainly in our lifetime, certainly my lifetime. And but we're going to get through it together, as we do as Americans and as Texans. And, helping each other is important right now. And we're all in this together. And together we're going to get through it. And my thoughts and prayers are with all of you.
Well, thank you so much for being so accessible, and I know people will be reaching out to your office. Thank you all so much for joining us today. Our website is continually updated throughout the day with the latest resources available to businesses during this time. Please remember to stay at home and wash your hands. We will be sending out information regarding upcoming webinars very soon. Thank you all again for joining us for our Pulse on Policy today, and thank you, Congressman McCaul, for your time.